pathophysiological part. Myself, Dr. Raktim Mukherjee, Assistant Professor and Head of the Department, Shri P.M. Patel Institute of PG Studies and Research in Science, affiliated to Sardar Patel University, Anand. The title of my today's talk in this first video series of epilepsy is Epilepsy followed by Etymology of the word epilepsy. The term etymology means how the word has been formed or what is the origin of this particular word. So, like most other words, even epilepsy has a origin, and most of the English words have either Greek or Latin origin. This word epilepsy is from Greek word. The origin is Greek word epilepsia. Epi means upon, that is upon, once upon a time, and lepsis means scissor. So, in turn, from ancient times, epilepsy was known as sacred disease. I don't know, I sometimes feel like laughing that what is so sacred about the disease. And now, what is the definition of epilepsy? The definition of epilepsy is a disorder of the brain. So, it is a neurological disorder. As I said, now I will move to neurological disorders. So, epilepsy is a disorder of the brain, and this disorder of the brain is characterized by enduring predisposition to epileptic seizures, electrical imbalance and seizure. The epileptic seizure is the main part. Okay. So, it is a disorder of the brain characterized by enduring predisposition to epileptic seizures. According to World Health Organization WHO, what is epileptic definition according to WHO? 2 or more unprovoked seizures, not that you are doing some electrode or electronically or you are stimulating the brain, not like that. Unprovoked, 2 or more unprovoked seizures, a chronic, no communicable disorder of the brain that affects all ages. All ages is important, right from a small kid to an adult. Everyone can suffer from epilepsy. Sometimes a family is devastated when someone suffers from epilepsy because they try their level best to get cured, and epileptic seizures can happen anytime, during the lecture, during classroom, anytime it happens. Then we have another set of definition, and these set of definitions are given by Epilepsy Foundation. According to the definition of World Epilepsy Foundation, epilepsy is a medical condition that produces seizures affecting variety of mental and physical functions. Every definition becomes broader. This is a much broader definition. It is a medical condition. Of course, it produces seizure. Seizure is the highlight, but this seizure can affect variety of mental and physical functions. Epilepsy Foundation also tells that this disease can be also called as a seizure disorder. When a person has 2 or more unprovoked seizure, they are considered to have epilepsy. You can only define epilepsy when the person has 2 or more unprovoked seizures. Okay. So, more or less like the WHO definition that we saw earlier, but only thing is that Epilepsy Foundation takes into account variety of mental and physical conditions. Now, what is epileptic seizure? Etymology of seizure, seize plus ur, it means sudden attack of illness, What is definition of epileptic seizure? An epileptic seizure is a transient. What is meant by transient? Not for extended duration of time, for a short duration, very short duration. So, epileptic seizure is a transient occurrence. What occurrence? Occurrence of signs or symptoms of abnormal electrical activity of the brain. Student, this is the Bible of today's, Bible, Gita or Quran of today's lecture, electrical activity of the brain. Whenever you talk about epilepsy, we always refer to the electrical activity of the brain, and this is the reason every student who is attending my lecture on epilepsy, they are supposed to know 12th standard basics of action potential generation. You have sodium channel, the chloride channel, the sodium potassium ATPase, how action potential is generated, and what are the different ion channels. This basics everyone should have. Some of the aspects, of course, I will cover in my lecture, but it is better you have some prior understanding. So, epilepsy manifests itself as a disturbance of consciousness. You are attacked by epileptic seizure, you are left unconscious or you lose consciousness for a time. You know, sometimes the patients will give you tight slap, okay, might hit you, and afterwards you ask them that what you did, why you are behaving such strange way, they would have no answer. So, it is a disturbance of consciousness, it is a disturbance of behavior. A very white collar person, perfectly well behaved, okay, white collar executive, all of a sudden during epileptic seizure the person's behavior becomes abnormal, the person's emotion changes, the motor function of sensation also changes. A person who always used to believe in Gandhiji all of a sudden starts behaving like a terrorist, starts hitting everyone in the class, in the conference room, would run around, and epileptic persons can be a trauma for the masses, because one epileptic person and the person goes wrong, he can spell doom in a closed door meeting. When the seizures happen where it happens? In the brain, of course. When it happens? When the cluster of nerve cells means nerve cells are not alone, so many nerve cells together, the cluster of nerve cells in the brain, they signal abnormally, abnormal signaling takes place, and because of this abnormal signaling, a person's consciousness, movement or actions of the person, which person? A person who is an epileptic patient, those actions are affected, and that affects per se the definition of epileptic seizure, that the person under sudden attack of illness or electrical disturbance in the brain because of conduction abnormalities. Now we shall discuss, since now what we know, we have defined epilepsy, we know it is a neurological disorder, we know it can affect every age group, we also know that the major reason manifestation of epilepsy is seizure, and also why seizure results because of the changes in the brain electrical activity. Since we have already highlighted the major outcome, that is seizure, it shall be worthwhile for me to discuss to the class the types of seizures. So, what are the types of seizures in epilepsy? We have partial seizures. In partial seizures, the partial seizures have focused origin in the brain, and the seizures may be present in a localized manner, not all around. Wherever the origin of which part of the brain the origin is there, that part will be affected, that is localized manner, not all together in localized. Then you have generalized seizures. Generalized seizure does not have a focal origin, not that it is from a specific spot. Partial seizure means this part of the brain, it is origin from here, only that part it affects. Whereas from focal origin, the generalized seizure, it will involve the entire brain. So, what is the difference between partial seizure and generalized seizure? Whereas a partial seizure affects a selective area of the brain, a generalized seizure can affect the entire brain. Then epileptic seizure. that can range from altered state of consciousness to those involving motor function with clonic or tonic components. Muscle tonicity or clonicity is affected, the person starts behaving strangely, the motor functions are affected. These are the characteristics of epileptic seizure. So, three types of seizures are there: partial seizure, generalized seizure not related to epilepsy, and epileptic seizure can always be associated with altered state of consciousness. Sometimes you are awake, sometimes you are unconscious, that is altered state of consciousness. Now, what is the epidemiology of epilepsy? How many people are affected? Which parts of the world are affected? Whether males are affected, whether females are affected, whether children are affected. Just now we said it affects all age groups, but what is the epidemiology of epilepsy? 30 million people worldwide suffer from epilepsy. This is again WHO data. How many? 30 million people worldwide. The prevalence rate is, out of every 1000 individuals, 4 to 6 persons are affected. So, the prevalence rate is 0.5%. So, half an individual in entire 100 lot will be affected by epilepsy, or 4 to 6 persons every 1000 individuals. Epilepsy has been estimated to affect between 2,60,000 to 4,16,000 people in England and Wales. Of course, I do not have Indian data as of now, maybe in the next lecture I will bring. Currently, I have only the European data. What is the incidence of epilepsy? The incidence of epilepsy is 40 to 70 new cases for every 1 lakh annually, that is again 0.05%. It is twice as high as developing countries. 80% of the world's epilepsy is found in developing countries, and very interesting. I do not know the exact reason, maybe you have to read some research paper, but one of the reason is that compared to the affluent countries or developed countries, developing countries, the 80% of the epilepsy patients are in the developing countries. Whether it is the healthcare system, whether it is the diet, what influences, is still not known. Now, I come to the second part of my lecture. What is the pathophysiological process of epilepsy? What is the pathophysiology? So, in medical biochemistry, every disease is divided into three parts: the general introduction, the epidemiology, then comes pathophysiology, why the disease happens, and finally treatment or management of the disease. So, we come to the second part of our talk, unraveling the pathophysiological process. And the question we will like to ask is, what turns a normally functioning brain into a hyperexcitable one? You have a normal brain. How that normal brain all of a sudden becomes hyperexcitable? Why normal electrical impulses are not possible in a hyperexcitable brain? Or what transforms or what changes a normal functioning brain into a hyperexcitable one? Several theories are there to explain the apparent disruption of homeostatic function, and this homeostatic function, when it is disrupted, it can alter neuronal excitation or neuronal inhibition. What is homeostasis? Homeostasis refers to the maintenance of several set point parameters of the body. Some of the examples I can give with respect to physiology: temperature 37 degrees centigrade, pressure systolic 120, diastolic 80, 120 by 80. So, all these set points are maintained. Osmolarity 300 milliosmol. Any of the set point is altered, the body will initially try it level best to maintain the homeostasis. Still it cannot maintain the homeostasis, it will get deranged in favor of a disease. So, several theories are there to explain the apparent disruption of homeostatic function that can alter the neuronal excitation, or it can also lead to inhibition. There are several theories, and some of the theories that I will be discussing in today's talk are extracellular ion homeostasis. Outside the neuron, what is the status of ion? We have several channels: chloride channel, sodium channel, potassium channel, calcium channel. So, what is the extracellular ion homeostasis in the extracellular space? Then altered energy metabolism, very important. In the last part of the talk I have included this altered energy metabolism, which is the fundamental carbon source of energy. Anyone?
Glucose.
Glucose, right? So, you try to understand. In the last part of our talk we will see that neurons undergo altered energy metabolism. That can be one of the reason to explain this apparent disruption of homeostatic function. The third point is changes in receptor function. Some of the receptors, the GABA receptors, the glutamate receptor, the adenosine receptors, the receptors changes in function. And last but not the least, there can be alterations in neurotransmitter uptake. Remember student, neurotransmitters released from presynaptic neuron. I will draw a diagram to explain it. You have a presynaptic neuron and you have a postsynaptic neuron. Here you have the neurotransmitters all, and once the voltage gated ion channels changes, the neurotransmitters are released. Neurotransmitter released into this synaptic space, and the neurotransmitter will bind to the neurotransmitter receptors, and these receptors are present in the postsynaptic neuron. I will write postsynaptic neuron, and this is presynaptic neuron. Okay. So, alteration neurotransmitter uptake, neurotransmitter from presynaptic neuron can bind to the receptor on the postsynaptic neuron. After that, the neurotransmitter can also be reuptake. Sometimes there can be alteration in the reuptake of neurotransmitters. Sleeping pills, selective serotonin reuptake inhibitors, SSRIs. So, they also are examples of receptor reuptake group of drugs. So, there is an alteration of neurotransmitter reuptake. Now, what is someone asks you an exam question that explain or enlist the theories to explain the apparent disruption of homeostatic function. These 4 points you are supposed to write for 2 marks, half a mark for each point. Someone asks you a 6-mark question, describe the pathophysiology of epilepsy and metabolic alterations. You have to divide the answer into pathophysiology followed by metabolic alterations, and that is what we will be describing in next couple of minutes. So, pathophysiology of epilepsy and metabolic alterations. Epileptic seizures, when do they result? They result from significant electrical discharges in hyperexcitable group of neurons, in which the normal neurophysiology is pathologically altered in favor of excitation over inhibition. The term significant electrical discharge that refers to threshold or suprathreshold. What is threshold? Minimum electrical discharge is required, only then a nerve impulse will be generated, that is called as threshold. Less than threshold is called as subthreshold. Whenever there is a subthreshold stimulus, there will be no nerve impulses. Likewise, if there is the strength of the stimulus is very big, it is called as suprathreshold stimulus. Suprathreshold stimulus can also lead to propagation of action potential. Now, that is electrical discharge, significant. Next is hyperexcitable group. Remember students, what I said, epilepsy may not affect the entire brain, it is only in the some part of the brain. and that part of the brain we don't have one neuron or two neuron, certain group of neuron, they are called as hyperexcitable group of neuron, and those hyperexcitable group of neurons are the ones which will cause significant electrical discharges. The brain was absolutely normal, there was perfect electrical synchronization, good deal of action potential. It is just because of the hyperexcitable group of neurons that electrical discharges will convert a normal neurophysiology into a pathologically altered in favor of excitation over inhibition. So, because of these changes, it will favor excitation and it will disfavor or it will inhibit the inhibition, and this is how the pathophysiology of epilepsy and metabolic alterations progress. What I have a fantastic animated diagram which I have made to explain the point. This is what it is. This is a hyperexcitable group of neuron. Of course, I have shown only one neuron, but try to understand there are several neurons. This is just a representative diagram I tried to give you so that the meaning becomes clear, but actually there are hyperexcitable group of neurons means there are several neurons which form hyperexcitable group of neurons. So, what happens? Significant electrical discharge, you can see electrical discharge. Once the electrical discharge takes place, the normal neurophysiology is pathologically altered in disease state, not under normal state, is pathologically altered to favor excitation over inhibition. So, that is the normal neurophysiology is pathologically favored in response to excitation over inhibition. So, once again I will explain. Likewise, you had the blue group of neurons, likewise you have the brown, the sky blue. Out of the different group of neurons, you have to imagine, say this group of neuron is hyperexcitable group of neuron, hyperexcitable. Now, the question is how hyperexcitability results. So, how hyperexcitability results? So, significant in those group of neurons which I have highlighted with yellow, significant electrical discharge takes place. जैसे we have short circuit in wire, likewise in a single minute or single millisecond, lots of electric potential has been generated in those hyperexcitable group of neurons. Why hyperexcitable? Unlike other neurons, the browns, the blues, this neuron has excess electrical conduction, so it is hyperexcitable group of neurons. This hyperexcitable group of neurons will convert the normal neurophysiology in favor of excitation, and that is how it becomes the pathologically altered neuron which shows excitation over inhibition. Because of significant electrical discharges, normal neurophysiology is pathologically altered to favor excitation over inhibition. Actually, in book when you read, it is slightly difficult to understand. So, I have included all these animations so that you understand how exactly the mechanism is taking place. So, what is epileptic seizure? Epileptic seizure results when there is a decrease in inhibitory signal and increase in excitatory signal. Students, let us see the last slide. This is where we said that once the hyperexcitable group of neurons come into picture, the pathologically altered, it will favor excitation by down regulating inhibition. This is what is highlighted. It will downregulate the inhibitory signal and upregulate or increase the excitatory signal. This alterations will lead to altered response to input signal. This altered response to input signal is one of the probable cause of etiology for epilepsy. So, someone asks you that what is the basis for epileptic seizure? Another way of explaining is, you can explain that epileptic seizure results because of altered response to input signal. Elaborate. So, altered response to input signal, there are inhibitory signal which is down regulated and there is excitatory signal which is up regulated. This alteration will convert a inhibitory neuron or inhibitory signal into a excitatory signal. Now, when we are talking about only one neuron, it is excitable, but if it happens in a hyperexcitable group of neurons, at that time we will say it is happening in a group of excitatory signal, that is in a significant group or in large numbers. So, all of which probably contribute to etiology of epilepsy. So, decrease in inhibitory signal, increase in excitatory signal. Now, what is hyperexcitable state of neuronal networks? So, question that can be asked in exam can be, name the factors that contribute to hyperexcitable state of neuronal network. Name the factors that contribute to the hyperexcitable state of neuronal network. So, what are the answers? Within neuron, altered function of ion channels, such as those controlling influx of some of the ions, very important, calcium Ca2 plus, potassium K plus, Na plus, sodium, a decrease in inhibitory gamma aminobutyric acid GABA receptor signaling. Together all this with excess of glutamanergic excitatory signal. So, remember there are two types of postsynaptic action potential. One is IPSP. IPSP stands for let me write IPSP. IPSP stands for inhibitory post synaptic potential. It will cause inhibition in the post synapse, and likewise you have EPSP. EPSP stands for excitatory postsynaptic potential. If it is an excitatory amino acid, it will cause EPSP. If the nerve endings release inhibitory amino acid, it will be IPSP. So, that determines whether it is EPSP or IPSP. So, the question is, name the factors that contribute to hyperexcitable state of neuronal circuit. It can be most of the ion channels such as Ca2 plus, Na plus, K plus, decrease in inhibitory GABA and excess in glutamanergic excitatory signal. So, once excitatory signal is favored over inhibitory signal, it will lead to hyperexcitable state of neuronal network. That is not the signal for you to log out. Now, how excessive excitation is triggered? How excess excitation is triggered? What is the mechanism? Okay. So, what is the mechanism? Let us see in an animated format. Some of the mechanisms, when I say some of the mechanisms, multiple mechanisms may be possible. Some of the mechanisms, what it does, it will decrease the threshold. What threshold? neuronal action potential threshold. How it decreases? You can see decrease. So, how it decreases? It decreases the threshold from supra threshold to sub threshold. So, some mechanisms decrease the threshold from supra threshold to sub threshold. Because of the decrease from supra threshold to sub threshold, it will lead to excessive stimulation or triggers excessive stimulation. This excessive trigger or stimulation will lead to the excitation. So, often called as synchrony. This is one of the mechanisms. Once again, let me explain to the class. Some mechanisms will convert supra-threshold stimulus into sub-threshold stimulus. Supra is, you can see, is more, sub you can see is less. So, obviously, there is a decrease in threshold. You can see decrease in threshold. This decrease in threshold will trigger excessive stimulation, and that is what is called as hyperexcitation or excessive stimulation of neurons. Now, we will discuss one important definition can be asked in examination. What is synchrony? What is synchrony in epileptogenic group of neurons? As I mentioned when Drashti asked me to explain again, that it is a group of neurons, and those group of neurons compared to other neurons are hyperexcitable, right? Don't die, I explained. So, what is the synchrony in epileptogenic group of neurons? Why they behave together? जीना यहाँ मरना यहाँ, right? साथ साथ में. How it does behave together? That is synchrony, synchronous, synchronization. So, synchrony, someone asks you a 2-mark question in examination. Enlist the factors that affect synchrony or what favors synchrony. So, synchrony is favored by altered neuronal connectivity. Once the neuronal connectivity is altered in a different wiring, okay, one wiring is from the main switch to your fan, another wiring from main switch to some other circuit, from another MCB to another circuit breaker, and finally to the fan. So, whenever there is an altered neuronal connectivity, it leads to recurrent circuitry, more and more complicated circuitry, recurrent. The electrical current, even if it is in milli or microvolts, can lead to recurrent circuitry. This recurrent circuitry is called as synchrony, and this synchrony is favored by altered neuronal circuitry leading to recurrent circuitry. Recurrent, we say that one day you are absent, again you are absent, third day you are absent, recurrent, he is recurrently absent, or you have recurring deposit. Every month you are depositing 100 rupees or 1000 rupees in bank, and then finally you get interest, that is recurring deposit, happening at a regular interval or fixed period of interval, that is recurrent. So, here also it, because of altered neuronal connectivity, it leads to recurrent circuitry. This recurrent circuitry will lead to synchrony. Now, we stop at this point, that what is the alternative basis of hyperexcitability? That not only the intrinsic deficiency of neurons, but also the disruption of homeostatic and metabolic functions. If you have a homeostatic and metabolic dysfunction, even then the alternative basis of neuronal hypersensitivity is there, and this is controlled by astrocytes. And the next day's lecture is going to be very important, because I will be explaining a phenomenon called as astrogliosis. Professor Van Baars, from a very noted scientist, recently in Nature his article came, actually he expired. He is the pioneer of astroglial cells, or all the glial cells. So, if you happen to read any of the Van Baars article, you will find astrogliosis. So, next lecture I will focus on astrogliosis. For this part, there is an alternative basis for neuronal hyperexcitability, that neuronal hyperexcitability can also result when there is a disruption in homeostasis or disruption in metabolic function, and these functions are controlled by astrocytes. So, anything related to astrocytes, especially astrogliosis, that can alter the neuronal hyperexcitability.